Hi everyone, my name is Jopa Islam. Today I'm going to talk about heart failure. The pickup question I chose with my classmate was uh, in adult uh, patient with congestive heart failure, how does patient-centered heart failure education compared to standard heart failure education affect hospital readmission within 6 months? So during this study, uh, I find that with my classmates, we work together in group, but I find that um, most patient readmission was due to not the fact that the patient don't receive enough education. And so they discharge home and they have a lot of, they make a lot of I would say some mistake about taking their medication, about their habit, and we think that by choosing this topic, we like to call all the nursing staff, or especially nurse, to focus attention during the education in the hospital for the education of our patient, especially those with heart failure. So we think that it's not just to give the after visit summary to the patient, the AVS, but the nurse should also sit down with the patient. I know that is not enough, but since the nurse sometimes is busy, that's why we try to find something like a counselor position, a nurse counselor. After the nurse teaching, those patients can also sit down with those counselors to have more knowledge about their condition. So that was the main what we trying to propose to reduce uh, patient with congestive heart failure. Teaching, teaching, and teaching. Never stop teaching. So we can talk about medication. We can talk about their lifestyle, reduce salt on the food, reduce the amount of liquid they are taking. All these can help the patient to reduce, to have a good quality of life and reduce hospital readmission. Thank you.